Edition Coronavirus Q&A.
And thanks for joining us for this special edition of KGW Q&A. We're continuing our coverage of the coronavirus outbreak. This entire half hour, we're focused on answering your questions. And we want to start with a debate amid health agencies tonight. So the state just released a list of COVID-19 cases per zip code. They say they want to be transparent and help people understand how this virus spreads. But Multnomah County says the numbers are misleading because testing has never been up to par. And outbreaks in nursing homes are skewing the numbers in some counties. So what's the takeaway here? What should you do differently? Maggie Vespa asked the county's public health director that question.
What is your message to people knowing that they do have access to these figures?
My message is that we're dealing with community spread, that COVID-19 is in all parts of our community, and that we are all in this together no matter what zip code you live in. I want people to continue to be using precautions, physical distancing, great hand hygiene, wearing a face covering if that's comfortable for you, and to continue to check our biases and assumptions, and ultimately, we're in this together.
And as we get more data, we get more questions from you. Joining us tonight is Dr. Claire Wheeler, a public health specialist with PSU and OHSU, to answer some viewer questions. And Dr. Wheeler, this is a great viewer question we got this afternoon. The person says, I have heard there are multiple variations of the virus in some countries. Do we have multiple variations here? And does having multiple variations in the virus mean that the people can get sick more than once?
Yes, we absolutely have multiple strains of this virus all over the world. And I have a little visual to show. This is a little map of the whole world, and you can see all these different colors, and those are all different strains of this virus that have moved all over the world. And so this is how we know, for example, that some of the first cases in California probably came from Europe and not from China, because when we take the virus from a patient's cells, we can map their RNA, and they have this is all the genetic material that this virus has. And here's the piece that codes for that spike protein that binds to our lungs. And when the shape of that changes, that's when this virus becomes able to infect humans in addition to bats and other animals. So time this sequence changes a little, that means we have a new strain of the virus. And then because it has changed just that much and we can map that RNA, we can make maps like this one where we can follow these different strains all over the world and see where they're going and how they're behaving. Now, just yesterday, a lab in Los Alamos, New Mexico, released a study that suggests that there's a strain that is a lot more contagious than the original Wuhan strain, and that it is around, and it may be in the United States as well. So viruses, by their very nature, are constantly mutating. Every single time they infect someone and they're making a virus, you could have a mutation then, and they're gonna continue to do that. So right now we know the pattern of mutation in the flu, right? So we have a flu shot every year. What we don't know is what do these mutations mean in terms of long-term immunity, and whether or not we're going to be able to get by with just one round of vaccinations.
Okay, summer is just around the corner and swimming is in mind. This viewer wants to know, is there evidence that chlorine kills the coronavirus?
Oh, absolutely. I've been using chlorine, taking bleach and diluting it, and I have it in spray bottles all over the house. It's a fantastic way to kill a virus. Mm-hmm. So I went on and I looked at the CDC website, and basically they said that as long as you're following the guidelines that the CDC has long recommended in their environmental health division for the concentration of chlorine that's going to be in the pool, then the CDC at this point in time deems it safe to go swimming.
Okay. So this next question, I'm sad for this person because I think I know your answer, but this viewer said, if you had your dream wedding planned for July 18th, would you keep the date or reschedule for next year? They ask, do you think restrictions will be lifted by then?
You know what? I have one daughter. She was going to get married on June 13th of this year. Aww. My dream wedding, and it is first we postponed it until next September, and now we're talking about canceling it because the restrictions may or may not be lifted, but it will not be safe to have a wedding in July. It just simply will not. So I think we really need to balance with restrictions. And we really need, we have this report that the White House released about opening up America. And it's actually a really good plan. And there are 4 stages. And we haven't even done what we need to do to get to stage 1.
Right.
And we don't open schools till stage 2. Right. So I would say the best thing to do is just plan to lay low this summer. And you know, really just kind of take it easy and postpone these big events till at least next summer.
Yeah, that's what I thought you were going to say, but had to ask. And then
I'm always the fun, kill the fun every time.
No, it's great. I know that you're cautious. All right, and so our last question for you. This person wants to know. We got an email today about this. What do we know about whether children can transmit COVID, even though they do not seem as affected as adults? If they can be carriers and transmit it, what implications does this have for school openings in the fall? That was from Lisa, a viewer.
Yeah. Yes, and this is the problem, the blessing and the curse of all of this is that our children are not getting terribly sick and dying in large numbers in this pandemic, and I'm very grateful for that. However, they get mild or asymptomatic illnesses, and they're very good at spreading, partly because of the way kids behave, and also it may just be something about the epithelial tissues of their airways. So far, the studies from China are showing that adolescents seem to be a lot more likely to spread this than little kids are. So that's a precaution to be aware of. But again, getting back to the White House plan about opening schools, that can happen until stage 2. And part of the reason for that, and one other thing to think about, not just the kids going to school and going home to mom, but the cafeteria workers, the bus drivers, the people who clean our schools. These are the underserved populations that are frequently minorities or they don't have adequate insurance, and they will all be at risk when those children go back to school. Really, I hope and pray that school systems all over the country are taking everybody involved into consideration when making these decisions.
Right. All right, Dr. Wheeler, thank you so much again for your time and for just all of your great answers.
My pleasure. Thank you.
And at any time you can send in your questions. There's a new number to text. It's 503-226-5088. If we don't get to your question tonight, we'll be answering your questions right here at 7 o'clock Monday through Wednesday. And still ahead, we're 2 months into our fight against the coronavirus. So what's working and how are we doing so far? But first, a question. Is it okay for me to donate blood? The answer, the CDC encourages people who are well to continue to donate blood if they're able. And welcome back. You know, the pandemic has put a strain on hospitals across the country. But what sort of changes to the healthcare system would doctors like to see so there can be a better response to emergencies? Dr. Lippy Roy has the answer.
That is such an important question. I mean, I hope there are a lot of lessons that we learn from this current pandemic and this epidemic, because I promise you we're going to have another epidemic. But one of the many lessons I hope we've learned is that we as a nation really need to invest in public health and public health strategies. In 2019, Congress appropriated $685 billion to the Pentagon, yet only $7 billion to the CDC. 685 versus $7 billion. So that must tell you where your taxpayer dollars and my taxpayer dollars are going. These are the questions that we really need to be asking and presenting to our political leadership.
And you know, we are 2 months into our fight against COVID-19. It feels like so much longer. So what is working and what isn't? Pat Doris looked at the numbers and has the answer.
When we take a look back from the 30,000-foot level, we see there are some things that have worked really well over these last 2 months. Social distancing, for example. Who'd ever heard of that? But you know what? It worked big time. We changed the culture, we made it okay to stay away from people, and the transmission rate of the virus has dropped by 70%. The latest projections are there may be no deaths from the coronavirus in Oregon by mid-June. We'll see. That'd be great if that happened. And also personal protective gear, the PPE that the hospital workers and other medical workers wear on the front lines. That was a real problem about 2 months ago. But then the state and the hospital systems both really got to work at staffing up and bulking up their inventory supplies, and they have succeeded. Right now, the state of Oregon has about 1.6 million surgical masks. They're expecting to get another 4.5 million masks in the next week, and the hospitals have enough as well. That's why they were able to open with those non-urgent elective surgeries. So There's a couple of things that are going really well, just over 2 months into this pandemic.
All right, Pat, great information. Thank you. Up next, are you still waiting for your stimulus check? We'll have a few steps you can take and answer why you might be seeing a delay. But first, a question: should children wear masks? The answer: they should not be put on children under the age of 2 because of the danger of suffocation.
Happy.
And welcome back. Stimulus checks are still going out, but what do you do if you still haven't received yours? Abby Larico has a few answers.
Status not available. 3 words that make up one of the more frustrating phrases for those awaiting a stimulus check, especially when they're really counting on that help. Like Lisa, who spoke to us anonymously and on behalf of a lot of people in her situation.
We heard a press release that all this money went out, but I know a lot of people that haven't gotten it yet.
Even weeks after launch, it's common to see an error message on the IRS Get My Payment Tracker website, used to see when your money is coming. There are a few common causes. Either you didn't file your taxes yet, or your most recent return is still being processed, and so is your check. If you receive certain benefits, like from Social Security or Veterans Affairs, your data might not have been added to the site yet, but it will be. The IRS site notes the data on the tracker is updated once a day overnight, so they advise you don't bother checking back more often than that. There's also the chance that you're simply not eligible for a stimulus check, perhaps because of having a high income, being someone's dependent, or not having a valid Social Security number. And if you don't file taxes but are eligible, you need to visit the non-filer tool on the IRS website so you can still get your stimulus money. The team at Anders CPAs and advisors tell us there's no good way to reach the IRS at this time. All you can do is wait. They say paper checks are being sent to taxpayers with the lowest income first, and it could be some time before all checks make it through the mail. So if you're still waiting, you're not alone. Some, but not all of the clarity Lisa would like right now.
This money that's due to me would be very helpful now in getting through this crisis period. And I can't even get an answer to when I'm ever going to see it.
Yeah, definitely frustrating. Restaurants and hospitality industries have seen massive layoffs, but healthcare, supermarkets, transportation, and logistics, they still desperately need workers. And for those that can't adapt to work, how can I get a job right now in a different industry? NBC financial correspondent Stephanie Ruhl has the answer.
Absolutely. It might not even be a completely different industry. Some of those big companies, Walmart, Amazon, CVS, all hiring right now, not just for in-person jobs, but they're also hiring for remote jobs because a lot of people have had to go home because their kids are home now. A lot of those companies, Rosetta Stone, the foreign language company, they're hiring right now, United Healthcare. And actually, if you go on Amazon.jobs right now, it's right there on the home page, and you type in your region, your state, there's going to be a listing of all the jobs available to you. So a lot of those logistic jobs are hiring. The pushback over the last week, can those big employers bring in employees to do that essential work, but at the same time keep them safe? And a lot of those companies are trying to work through that right now.
When restaurants and bars reopen, how will things work? How will things go right back to normal? Keely Chalmers has the answers from the governor's updated plan.
Under the latest draft plan obtained by the Oregonian, restaurants will still be required to separate diners by at least 6 feet. But contact tracing, which was included in the initial draft plan, that was taken out. Now, that proposal would have required restaurants to collect the names and phone numbers of all the patrons. The idea behind that was that if someone caught the virus, the restaurant could track down everyone that might have gotten infected and warn them to isolate themselves to prevent the spread. Now, some argued that went a bit overboard, and it looks like the state agreed. Now, also under the new draft plan, buffets, salad bars, or self-serve soda fountains won't be allowed. Restaurants and bars will be required to close by 10 p.m., and all staff will be required to wear face masks. Now, the new draft plan also allows for limited bar seating as long as there is a window or some sort of protective barrier in place. But again, this is still just a draft plan. It very well could change again.
And still ahead, which Oregon state parks are now open and what could be open next? But first, you wanted to know, if I have recovered from COVID-19, am I immune to it? The answer, the CDC is still trying to figure this out. At this time, it's unclear if you can become reinfected. And welcome back. So the Better Business Bureau is warning shoppers to be wary of companies claiming that they can kill the coronavirus better than their competitors. So we talked to the BBB about why this warning is so important.
We had decided that it would be a good time to alert consumers about picking cleaning or disinfecting companies very carefully at this point, as we look towards a little bit of a light at the end of the tunnel here, some potential for reopening in the next couple of months. A lot of people are probably going to want to deep clean their homes. And we've noticed that there have been some companies cropping up marketing some out-of-the-box tactics or products that have not been proven to work.
What specifically would you like people to warn? Do you want to warn people about?
And the first thing that comes to mind is this ozone fumigation tactic. Ozone fumigation is good, you know, in terms of cleaning your air, get the particles out of the air, allergens, things like that, but it's not proven to kill the virus, the COVID-19 specifically. And when we're talking about other disinfecting agents or other cleaning products that you might see advertised, just because something is advertised as killing another coronavirus or SARS doesn't mean that it's successful against COVID-19, at least not yet. We don't know that yet.
And as of today, some Oregon state parks and outdoor recreation areas are back open. So a lot of you wanted to know which parks are open. Here's the list. Tryon Creek is the closest to Portland, but when you read this list here, you're going to notice that some popular spots in the gorge and on the coast, they're not included. That's because those will remain closed. Now, for the spots that are open, parking will be limited to discourage crowds, and social distancing is still in place.
Even when people visit, they need to remember all of the things that they're doing now to protect their own health and the health of the people around them remain true when you're taking a short trip near your home to visit a park.
You should definitely wear face masks and bring your own hand sanitizer. More state parks will open next week. Governor Brown's office says that she'll also issue an executive order allowing ski resorts to resume activities. Now, for almost 2 months, kids have been learning at home, and we know it's a challenge. I think that's an understatement. Tomorrow, in a KGW Q&A webcast, you can get some expert advice from learning specialists. Host Galen Etlin explores the do's of distance learning. That's at noon on KGW.com. You can also check that out on any of our social media pages. Definitely weigh in, ask your questions, and definitely tune into that. Always some great information from some great experts. And thank you so much for joining us tonight. KGW is committed to continuing coverage on the coronavirus outbreak by answering your questions. If you still have questions, our past stories may answer them for you. You can go straight to kgw.com/answers to see all of our past Q&As, all of our past stories, and we'll see you back here Monday through Wednesday at 7 p.m. to answer all of your questions.